Robert was 67 years old the night he slept on the bathroom floor. Not because he fell, not because he was sick, because getting up and walking back to bed between trips to the bathroom had stopped making sense. By 3 a.m., he'd made 6 trips. 6. And each one produced little more than a trickle and a burning pressure that made him grip the sink and breathe through his teeth. His urologist had a name for what was happening to Robert's body: benign prostatic hyperplasia. The word benign made Robert want to laugh. There was nothing benign about what his life had become: the constant urgency, the weak stream, the feeling that his bladder never fully emptied, the embarrassment of having to map every public restroom before he could leave the house. His doctor had offered him 2 options: medication that carried a long list of side effects, including sexual dysfunction, dizziness, and fainting, or surgery. Robert was 67. He wasn't ready to accept either. What he didn't know, what his urologist never once mentioned, was that his prostate was responding to something, a specific biological trigger that 6 natural compounds have been shown to directly interrupt. Here's what I'm going to share with you today: 6 vitamins and nutrients, backed by peer-reviewed research, that have demonstrated real, measurable effects on prostate tissue, urinary flow, and the hormonal cascade that drives prostate enlargement in men over 60. Not folklore, not marketing copy. Clinical data that the pharmaceutical industry has very little financial interest in publicizing. I've spent 22 years in integrative urology. I've sat across from men exactly like Robert, men who were handed a prescription and a pamphlet and sent home. My mission, every single day, is to give you what that appointment never did: the complete picture. Stay with me through all 6, because the last one, number 6, is the one that surprised me most. And it's the one most men over 60 are dangerously deficient in without knowing it. Before we get to the list, I need you to understand what is actually happening inside your prostate right now. Because once you see the mechanism clearly, every item on this list will make immediate sense. Your prostate is a walnut-sized gland that sits directly beneath your bladder and wraps around your urethra. In your 20s and 30s, it stayed quiet, cooperative. But starting around age 40, something shifts in your hormonal environment. An enzyme called 5-alpha reductase begins converting your testosterone, the very hormone that gives you energy, drive, and muscle, into a far more potent compound called DHT, dihydrotestosterone. And DHT is, in the simplest terms, prostate fertilizer. It binds to receptors in your prostate tissue and tells those cells to grow. By 60, over 50% of men have measurable prostate enlargement. By 70, that number climbs to 70%. And by 80, it's nearly 90%. This is where it gets critical. The enlargement itself isn't the problem. The problem is what the enlargement does to the urethra it surrounds. As your prostate grows, it squeezes that tube. It's like pinching a garden hose. The pressure builds, the flow weakens, the bladder works overtime trying to compensate, and you end up, like Robert, counting ceiling tiles at 3 a.m. What the standard medical conversation almost never includes is this: several naturally occurring compounds have demonstrated the ability to inhibit 5-alpha reductase, reduce DHT binding, decrease prostate inflammation, and in some studies, measurably reduce prostate volume. Not as powerfully as pharmaceutical inhibitors, but without the sexual dysfunction, the dizziness, the liver load, and the dependency that come with those drugs. Your prostate is not beyond help, and surgery is not your only option. Here are the 6 nutrients the research actually supports. Vitamin 1, Saw Palmetto extract. Let's start with the one you've probably heard of, but almost certainly haven't been using correctly. Saw Palmetto is derived from the berry of the Serenoa repens palm, and it has been used for prostate health for well over a century. But here's what most men who take it don't know. The standard Saw Palmetto capsule you find at the grocery store contains a level of active liposterolic extract so low it will do almost nothing for your prostate. The mechanism matters here. Saw Palmetto works by inhibiting both types of 5-alpha reductase, the enzyme I described earlier that converts testosterone to DHT. A landmark review published in the Cochrane Database of Systematic Reviews found that men taking a standardized Saw Palmetto extract reported significant improvements in urinary flow rate and nighttime urination frequency compared to placebo. Here's the catch. Studies showing real results used extracts standardized to 85 to 95% fatty acids and sterols. The dose that matters is 320 milligrams per day of this standardized extract, not the 80 or 100 milligrams you'll find in a generic multivitamin. and it needs to be taken consistently for at least 8 to 12 weeks before you evaluate whether it's working. What it won't do is shrink your prostate overnight. What it can do, with the right dose, the right standardization, and enough patience, is measurably reduce the DHT activity that's driving your symptoms. Men in studies report better urinary flow, fewer nighttime trips, and less urgency. The research is consistent enough that several European countries include Saw Palmetto in their official clinical guidelines for mild to moderate BPH. Robert, by the way, had tried Saw Palmetto twice before. Both times he'd bought the wrong product. We'll come back to him. Vitamin 2, zinc. This one surprises people, and the surprise becomes outrage once you understand why. The healthy human prostate contains more zinc than any other organ in your body. More than your liver, more than your kidneys. Your prostate is by biological design a zinc-accumulating organ, and zinc plays a direct role in regulating the activity of 5-alpha reductase, controlling prostate cell proliferation, and managing the inflammatory processes that make BPH symptoms worse. Here's the part that should make you angry. Studies consistently show that men with enlarged prostates have dramatically lower zinc concentrations in their prostate tissue than men with healthy prostates. Research published in the Journal of Urology found that as prostate disease progresses, zinc levels in the gland drop precipitously. The prostate loses its ability to hold on to the mineral it was designed to concentrate. And yet, almost no urologist checks your zinc levels. Almost no BPH conversation includes zinc replacement. The mistake most men make when they do supplement is choosing zinc oxide, the cheap form found in most multivitamins. Zinc oxide has poor bioavailability. Your digestive tract absorbs very little of it. The forms that actually reach your tissues are zinc picolinate or zinc citrate, typically at doses of 25 to 45 milligrams per day. Above 40 milligrams for extended periods, you'll want to supplement with 1 to 2 milligrams of copper as well, since high-dose zinc can deplete copper over time. Think of zinc as the nutrient your prostate is starving for, and has been starving for quietly for years. Vitamin 3, beta-sitosterol. If you've never heard this name, pay close attention, because the research behind this compound is some of the most compelling in the entire field of natural prostate support. Beta-sitosterol is a plant sterol found in high concentrations in pumpkin seeds, pecans, and avocados. It's also the active component responsible for most of what people attribute to Saw Palmetto. But in isolation, at therapeutic doses, its effects are considerably more documented. A double-blind, placebo-controlled trial, published in the Lancet, one of the most respected medical journals in the world, found that men with BPH who took beta-sitosterol showed significant improvements in urinary flow rate, post-void residual volume, and symptom scores compared to placebo. Not marginal improvements, statistically significant ones. The mechanism is multi-layered. Beta-sitosterol competes with cholesterol for absorption and reduces the substrate available for DHT synthesis. It also has direct anti-inflammatory effects on prostate tissue. And inflammation, I want to be clear, is not just a side effect of BPH, it is one of its primary drivers. An inflamed prostate swells. A swollen prostate constricts your urethra. Reducing that inflammation directly relieves symptoms. The effective dose in studies is 60 to 130 milligrams of pure beta-sitosterol daily, not mixed plant sterols, but beta-sitosterol specifically. This is the distinction that matters. Products that list plant sterols as their active ingredient may contain only a fraction of the beta-sitosterol you're actually paying for. Before we move to number 4, I want to share something I've been recommending to my patients for the past several months that directly addresses this compound, and 2 others we've already covered. It's called Prostadine, and it was specifically formulated for men over 60 dealing with the kind of progressive prostate and urinary symptoms we've been discussing throughout this video. I discovered it while reviewing the clinical literature on multi-ingredient prostate formulations, and what stopped me was the combination of bioavailable ingredients at documented doses, including Saw Palmetto at a standardized extract level, zinc in its absorbable form, and beta-sitosterol in the therapeutic range. If you've been dealing with the nighttime urgency, the weak stream, the pressure that never quite releases, this addresses the exact mechanisms behind all 3. The link is in the description below if you want to take a look. No pressure, just the option to learn more. Most of the patients I've directed toward it report a noticeable shift in nighttime frequency within 3 to 4 weeks. Not a cure, not a dramatic transformation, but the kind of gradual, real improvement that tells you something in your body is actually responding. Now, let's get back to the list, because number 4 is something 84% of men over 60 are deficient in, and almost none of them know it. Vitamin 4, vitamin D3. The connection between vitamin D and prostate health is one of the most underappreciated stories in men's medicine. Vitamin D receptors are found on prostate cells. This is not incidental. Your prostate was designed to interact with vitamin D, and when your vitamin D levels drop, your prostate cells lose a critical regulatory signal that helps keep their growth in check. A large-scale study published in the European Urology Journal found a direct inverse relationship between vitamin D levels and prostate size. Men with the lowest vitamin D levels had the largest prostates. Men with sufficient levels had significantly lower BPH symptom scores. A second meta-analysis confirmed that men deficient in vitamin D were substantially more likely to develop lower urinary tract symptoms associated with BPH. Here's the reality for men over 60. Your skin's ability to synthesize vitamin D from sunlight decreases by roughly 50% between the ages of 20 and 70. If you live north of Atlanta, which covers most of the United States, you are receiving inadequate sunlight for vitamin D production for at least 4 months of the year. If you spend most of your time indoors, you may be in a state of functional deficiency year-round. The target serum level for 25-hydroxyvitamin D, the blood test that measures your actual levels, is between 50 and 80 nanograms per milliliter. Most men over 60 test well below 40. Correcting this typically requires 3,000 to 5,000 IU of D3 daily, taken with a meal that contains fat for proper absorption, alongside vitamin K2 to ensure proper calcium metabolism. Ask your doctor to run a vitamin D panel at your next appointment. I've rarely seen a man over 65 come back with optimal levels on the first test. The deficiency is almost universal, and its consequences go far beyond the prostate. Vitamin 5. Lycopene. Lycopene is the compound that makes tomatoes red. It is also one of the most powerful antioxidants your prostate tissue has access to, if you give it the right source. The prostate gland naturally accumulates lycopene at concentrations significantly higher than most other tissues in the body. This is not an accident. Lycopene has been shown to reduce oxidative stress in prostate cells, inhibit the proliferation of abnormal prostate tissue, and reduce levels of IGF-1, insulin-like growth factor, a protein that promotes prostate cell growth when elevated. A study published in the Journal of the National Cancer Institute found that men who consumed lycopene-rich foods at least twice per week showed significantly lower rates of prostate-related complications than those who rarely consumed them. The Harvard Health Professionals Follow-Up Study, one of the largest long-term studies of male health ever conducted, found that tomato sauce consumption specifically was associated with reduced prostate-related risk. Here's the critical detail about lycopene. It is fat-soluble, and its bioavailability increases dramatically with heat and fat. Raw tomatoes provide some lycopene. Cooked tomatoes, tomato paste, tomato sauce, roasted tomatoes drizzled with olive oil provide 2 to 3 times more absorbable lycopene per gram. This is the mistake most men make. They see lycopene on a supplement label and assume absorption is automatic. It isn't. Lycopene needs fat to travel from your digestive tract into your bloodstream. Take it with a meal. Or better yet, eat a half cup of tomato paste cooked with olive oil 3 times per week. It's the single most bioavailable food source of lycopene on the planet, and your prostate will use every molecule of it. Vitamin 6. Stinging nettle root. I saved this one for last deliberately, because this is the one that most surprised me, and the one I now consider essential for any man over 60 dealing with BPH symptoms. Stinging nettle root, not the leaf, the root, contains a specific set of polysaccharides and lectins that interact directly with sex hormone binding globulin, or SHBG. Here's why that matters. As men age, SHBG levels rise, and SHBG binds to testosterone, making it unavailable for your tissues to use. But it also binds to the receptors on prostate cells that DHT uses to signal growth. When SHBG occupies those receptors, it effectively blocks DHT from delivering its grow signal. Nettle root's active compounds appear to bind to SHBG directly, occupying the binding site so that DHT cannot. A double-blind, randomized controlled trial published in Phytomedicine found that men with BPH who took stinging nettle root extract over 6 months showed significant improvement in urinary flow and a reduction in prostate volume compared to placebo. Another study compared nettle root to finasteride, one of the most commonly prescribed BPH medications, and found comparable improvements in symptoms with dramatically fewer side effects. The effective dose in studies is 300 to 600 milligrams of root extract daily, standardized to at least 1% sterols. The root, not the aerial parts. This distinction matters because the two parts of the plant have entirely different chemical profiles and different mechanisms of action. Robert, the man who spent a night on his bathroom floor, started a protocol that included stinging nettle root alongside the other compounds we've covered today. By week 6, he was making 2 nighttime trips instead of 6. By month 3, he described his urinary flow as stronger than it had been in years. He told me it was the first time in 4 years he'd slept through until 4 a.m. He said that felt like a miracle. I told him it wasn't a miracle. It was biology. It was giving his body what it had been missing. If you made it here, I want you to know something. The fact that you watched this far tells me you are serious about your health. You are not waiting for a doctor to rescue you. You are doing the work of understanding your own body, and that is exactly the kind of person who actually gets better results. Here is what I want you to take away from everything we covered today. Your prostate is not out of control. It is responding to DHT, to inflammation, to nutritional deficiencies that have been building for years. Saw Palmetto, zinc, beta-sitosterol, vitamin D3, lycopene, and stinging nettle root are not random supplements. They are targeted interventions that address the specific biological cascade driving your symptoms. Used consistently, at the right doses, in the right forms, they give your prostate what it needs to stop working against you. Here's the challenge I want you to take on for the next 30 days. Write down your 3 most disruptive symptoms today: nighttime frequency, urgency, flow strength, and rate each one on a scale of 1 to 10. Start with even 2 or 3 of the nutrients from today's list. Then rate those same 3 symptoms again in 30 days. Your body will give you the data you need. If you want a formulation that already combines several of the key compounds we covered today, including Saw Palmetto at a therapeutic dose, bioavailable zinc, and beta-sitosterol in a researched range, I've left a link to Prostadine in the description below. Thousands of men over 60 have already started using it, and the consistency of what they report in the reviews is something I genuinely wasn't expecting when I first looked into it. The link is in the description. Check it out and see if it's right for you. If this video gave you something your last doctor's appointment didn't, hit the like button. It helps reach other men over 60 who are getting handed a prescription without ever being told this information exists. Subscribe, because every week I share honest health information this community deserves to have access to. And tell me in the comments which of these 6 surprised you most. I read every single comment. Everyone. Share this with one man in your life who is dealing with this. Your brother, your husband, your friend who mentioned it in passing once and changed the subject because he was embarrassed. This information could genuinely change the trajectory of his nights, his mornings, and his confidence. Robert sleeps in his bed now, every night. It took 4 months and no surgery. The answer was never on the other side of an operating room table. It was in the biology his body had been asking him to pay attention to all along. Your body is asking the same thing. Start listening.